Welcome back to episode 62 of Your Birth Bestie podcast. Today we are going to be talking about one of the most common questions pregnant moms have and that most feel embarrassed about, which is how to tell if your water broke or if maybe you just peed your pants. I have seen this scenario happen over and over again, and it's sometimes really hard to tell. So if this is you, you are not at all alone. And then once we talk about some tips on how to tell if it's urine or amniotic fluid, we will dive a little bit deeper into when you might want to consider going to the hospital or to OB triage to get checked out, and what your experience might be like when you go to get assessed. Hey there, I'm Beth Connors, a midwife and mom of two, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. As you probably already know, amniotic fluid is the liquid that surrounds and protects your baby in the amniotic sac. It's usually clear or pale straw colored and odorless, or sometimes even slightly sweet smelling, which is a really weird way to describe it, but there is a distinct smell that is different from urine, but it's kind of hard to describe. On the other hand, urine is typically yellow, has a distinct familiar odor. The main reason for moms to be confused, though, sometimes is that as your baby grows and puts pressure on your bladder, it can sometimes cause you to leak urine, especially when you laugh or cough or sneeze. So now that you know that there is a possibility of either happening, whether it's breaking your bag of water or accidentally having some urine leakage, I can share some signs that your water has maybe broken and also signs that it might just be urine, and then how to tell a difference. As far as feeling confident that your water has actually broken, first, does it look and smell like amniotic fluid, like I just mentioned before? That's a super basic assessment. The clear or pale straw colored, is it odorless? Maybe a slightly sweet smelling? And then if you don't know, because this one is not always obvious, one of the key differences is how much fluid there actually is, and then what the flow of it's like. When your water breaks, it can actually be a really dramatic gush of fluid or even a steady trickle, which can make it a little bit more confusing, but is actually helpful to know that either is possible when your water breaks, that it's not usually like they show in the movies where your water breaks and everyone starts rushing around and baby is born shortly after. There actually is a statistic on how many moms that have their water broken before labor starts, like in the movies, and that's about 10 to 15% only. So it's really not all that common. Some moms describe this feeling like they peed their pants with a warm gush of fluid, but the sensation then doesn't stop. Unlike urine, which you can control to some extent, amniotic fluid will just continue and continue to leak throughout your entire labor until your baby is born. So if you notice a constant flow, even if it's a slow trickle, it's more likely that your water has actually broken. It's not one of those things where your water breaks, you have a gush of fluid, and then, check that off the list, labor is started. It actually continues to happen for the duration of your labor. Another trick I like to use when generally assessing if the water has broken is to have mom put on a clean pad, lie down, and then give a couple of really good coughs to see if anything else comes out and further assess it in that way. Or you can even change positions with a clean pad on, lie down for 15 minutes or so, and then when you stand up, if there is a gush of fluid, it is more likely to be amniotic fluid than urine. At this point too, if it is your water that broke, another important point is that you might see a small amount of blood or mucus in that fluid. And this is normal and can be part of what is known as the bloody show, which is a sign that labor is approaching or that you are in the very early stages of labor. Every pregnancy is different though, so the experience can vary from one mom to another. But generally, that bloody show indicates cervical change, which would be great if your water has broken and labor is starting and your cervix would then be starting to dilate and thin to then have your baby. So now let's talk about the signs that what is happening is probably urine and not amniotic fluid. Urine typically has a yellow color and a distinct smell, which can help you identify it. One simple assessment that you can do by yourself is to empty your bladder completely and then see if the leaking stops. If you change positions, like standing up after sitting down or lying down, and that leaking stops, it's more likely then to have been urine. It's important to remember that urinary incontinence, though, is quite common in pregnancy, especially as you get closer to your due date. Your baby is getting bigger and putting a lot of pressure on your bladder and also all of those pelvic floor muscles. They can definitely be a little bit weaker than normal. So this would be a good reminder to seek out help from a pelvic floor physical therapist if you are interested, and then coming up with a plan so this isn't regularly happening to you, and then reduce any concerns in that postpartum period, or really at least continue to address them if they are continually a problem, and just improve that quality of life, making sure that you aren't leaking all the time, because urinary leakage is very common for women who have had babies before, but that does not mean that it's normal, and that does not mean that it's something that you have to accept is going to happen for the rest of your life. So just knowing that there are treatment options and pelvic floor physical therapy, that is really amazing to help you have a personalized treatment plan and, get rid of this issue if this is something that's going on for you. And then after you consider all of those things I mentioned for either scenario, you still might not be sure if your water has broken or if you have just peed yourself, and that's okay. Calling your provider or going into OB triage to get checked out would be the next step. Your provider would be able to do a few different kinds of tests. Measuring the pH of the fluid is one of them, where a strip of paper is used to measure that pH level because amniotic fluid has a higher pH compared to urine. There is also a ferning test where a sample of the fluid is looked at under a microscope for a characteristic fern-like pattern. And if that fern pattern is seen, that would be a positive result and suggests that your water has broken. There's also a test that's more commonly used called the amnisure test that is used to detect the presence of amniotic fluid in the vaginal discharge. And what I didn't really mention before either is that the amount of vaginal discharge can greatly increase during pregnancy, especially near the end. So normal, clear vaginal discharge can sometimes be confused as someone's water breaking. So it's very individualized. There are a few different things that could be happening, and is why these tests are so helpful to really determine, what the fluid is. But what happens with this test is your provider, or you can also request to do this test yourself if you are more comfortable with that, will insert a sterile swab into the vagina for about 1 minute to absorb that fluid. And the swab is placed into a tube, and a strip similar to a pregnancy test is used to test that sample. And if the test shows 2 lines, it's positive and suggests amniotic fluid and that your water has likely broken, where a single line would be a negative result. And this test is very simple to do and very accurate. And also the results can be received very, very quickly in the clinic. So these are all benefits to help you and your provider make informed decisions about your care and really help you get more information as to what is going on. So let's say you get a positive result and your water is officially broken. What should you expect next? I don't want for anyone's initial reaction to be to panic and rush into the hospital right away, or even if you're there and getting checked out in OB triage, you are not required to stay there either if you are not ready to be. It is a case-by-case situation, if that would be recommended, but confirming your water is broken and given everything else going on, you can go back home with that extra information and then make a plan on when to return, laboring at home for as long as you want, if that's a possibility. The first thing to do is to stay calm. It is very natural to feel a huge rush of emotions, maybe some anxiety and fear, hopefully also some excitement and relief that you are finally going to be meeting your baby after all of this time. But taking a deep breath, staying focused, and trusting your preparation and the process that you are ready for this experience will really help you handle the situation more effectively. This would also be a time to avoid inserting anything into the vagina. Also, being aware that every cervical check has the potential to introduce bacteria into the area and also potentially irritate the cervix. So being mindful of that is important. And it's okay to request to have minimal cervical checks or to avoid those for as long as possible if everything else is going okay. So this is a completely reasonable request. It would also be helpful to make a few mental notes when your water broke, remembering the acronym TACO. And this stands for the time that your water broke, the amount of fluid that there was, the color, and then if there was an odor or not. Color is especially an important one because amniotic fluid is usually clear or pale yellow. So if you notice the fluid is green or brown or even little flecks of brown, anything like that could mean that your baby has pooped inside of you, and that would be considered meconium stained fluid. And this is more common with moms that have longer pregnancies past their guest dates and could be more serious, indicating potential fetal distress or suggest that baby just might need to be closely monitored during labor. Also, it's important to know that after your water breaks, labor may start right away or it might not at all. For many women, contractions begin within 12 to 24 hours after the water is broken, but the plan for safety of how long to wait for contractions to begin is an individualized choice. Having a plan for this is important because I recently had someone reach out to me that their provider said they would have to be given Pitocin to speed up labor if their water was broken for greater than 6 hours. I don't know of any research that supports this is a low risk mom and baby that needs to have their labor augmented with Pitocin after only 6 hours. So very well was probably the rushing along of birth in the hospital that is just so commonly seen, unfortunately. So please know that you do have time to wait, usually after your water breaks, before jumping to intervention and just giving your body a little bit more time. And even would be a great time to rest and get some hydration and nutrition and get your energy up. So that could actually be a blessing if your water breaks and contractions don't start right away. So it doesn't always have to be this negative pathological thing that's happening that you have all of a sudden now doubts in your body that you're going to labor naturally and you're going to have the experience that you want. So don't let people ruin that for you if this is the situation, and try to keep your labor environment very calm, relaxed. Go back home if you can and get into the zone and get ready to have your baby. By the 24-hour mark, if contractions haven't started yet, oftentimes providers will want to discuss options to induce labor because the longer that your water is broken, the higher the risk of infection for both you and for your baby. And like I said, providers all have different guidelines that they practice by, and some are willing to wait a little bit longer than others. So know your options, communicate with your provider, and at the end of the day, if you want to wait and ask for more time, that is your choice to make, as long as you are, aware of potential risks in your situation. And if that's something that you want to do, it should absolutely be respected. Like I said before, there may be other considerations, such as if there is green or brown amniotic fluid, if you're bleeding, if you feel unwell and have signs of infection like a fever, chills, foul-smelling discharge, or if you are GBS positive and planning to treat as well with antibiotics. These are all reasons that the timeline may change a little bit as well, so I just wanted to kind of bring that to your attention as well. Always being in communication with your provider while also upholding your values and advocating for yourself to have the experience you want is so important. Thank you so much for tuning in to Your Birth Bestie podcast today. Please remember that the onset of labor can vary widely, but staying calm, knowing what to look for, and when to seek medical attention can help you navigate this stage of pregnancy. I recommend moms to trust their instincts and stay in contact with your healthcare provider. They are there to guide you through the process and help you and baby stay safe. If you have more questions, please connect with me on Instagram at BethConnors_CNM or on my website at BethConnors.com. I would love to learn what support you are looking for in pregnancy and how I can make this the best possible birth experience. Thank you again for being here, and I will be back next week with another episode. Bye, everyone.